Hi, our topic for today is chronic renal failure in children. What are normal kidney functions? The kidney removes waste and excess water from the body. They also control the balance of sodium, potassium, phosphorus, calcium, and other chemicals in the body. Filtering process is done in the kidney through structures called nephrons. Water and waste and fluids are combined to form urine, which is eliminated through the kidneys. Normally, each kidney has approximately 1 million of nephrons. Damage to these units results in chronic kidney disease. What is chronic renal failure? Renal failure refers to permanent or temporary damage to the kidney that causes loss of normal kidney functioning, which are to filter the blood, remove waste and extra fluids from the child's body by making urine. Chronic renal failure progresses over a period of 3 months, and this can lead to permanent renal failure. It can be caused by acute renal failure that doesn't improve or is treated, a birth defect, or a chronic kidney disease. Medication and diet therapy can decline the child's kidney function. Ultimately, however, the child will likely need a kidney transplant or treat chronic renal failure. What are the stages of chronic renal failure? A child's stage of CKD is primarily determined by his or her glomerular filtration rate, which is also called GFR. A GFR test measures how effectively the kidneys are filtering blood. According to National Kidney Foundation, there are 5 stages of chronic kidney disease. Stage 1 would be kidney damage with normal or increased GFR. Stage 2 would be kidney damage with mild or decreased GFR. Moderate and stage 3 would be moderate decrease in GFR. Stage 4 would be severe decrease in GFR. And last would be kidney failure where the levels would be less than 15. So this is how the five stages of kidney transplant is explained, with different stages showing different levels of symptoms.
End-stage kidney disease. End-stage kidney disease, ESRD, which is a renal disease, has crossed the stage of healing or treatment. This can also be called stage 5. At this point, the child needs to go on dialysis or have a kidney transplant. Both are effective treatments. Around 75% of children with ESRD go on dialysis before receiving a transplant. Mild chronic kidney disease may not show noticeable symptoms. In most severe cases, chronic kidney disease that is getting closer to ESRD, symptoms can include vomiting, fatigue, and a lack of growth in children. Other symptoms of worsening kidney functions include abdominal swelling, decreased urination, and high blood pressure. Dietary restrictions. Regulate protein consumption based on body size, severity of the disease, and the amount of protein in your urine. Limit sodium intake. Consume foods low in phosphorus and calcium. Intakes of potassium should be regulated based on how well the person's kidneys function. Depending upon the stages of kidney disease, fluid will be required to be adjusted. Diet to follow post transplantation. A well balanced diet consisting of a variety of fruits, fresh fruits and vegetables, lean meats, reduced fat dairy products, whole grain, and plenty of water. Consume food low in salt and high in fiber. Consumption of foods rich in calcium and vitamin D are recommended to make up for the bone loss and to reduce the risk of any bone disease. Increase amounts of phosphorus and potassium in food. High protein intakes. Symptoms and causes. Causes. Obstruction or blockages in urinary tract. Alport syndrome, which is an inherited disorder that causes deafness, progressive kidney damage, and eye defects. Nephrotic syndrome, polycystic syndrome, cysticercosis. The symptoms which for chronic renal failure are bone pain, poor appetite, vomiting, urinary inconsistency, headache, malaise, bad breath, pale skin, and tissue swelling.
So, coming to diagnosis, it's important to remember that diagnosis of CKD can be done in two ways. The first could be like a diagnostic test that indicates a problem with your child kidney, and the other could be kidney function test that tell us how well they are working. So this diagnostic test can begin short after when doctor detects protein traces in child urine through urine analysis, and if the child shows signs of nephrotic syndrome, they will be put on steroids. Usually around 80 to 90% children will respond to steroids, while the other who does not get respond to steroids may potentially have a different causes that will need to be diagnosed. So this diagnosis tests include biopsy and ultrasound. So, kidney function test. Creatinine is a waste product that is produced by the body in a constant amount, and the only way to exit is via uh, kidneys. And a higher level of creatinine in the body indicates decreased kidney functions. Creatinine level is checked through a simple blood test. Coming to glomerular filtration rate test, it is a test that helps in measuring how efficiently and accurately your kidneys are able to filter your blood. So here are the four stages of kidneys with the treatment. In the first stage of kidney does not regulate acid levels. This leads to acidosis. The increased level of acid in the body leads to acidosis, and the treatment is through bicarbonate oral medication to balance the acid levels. The second stage is where the kidneys does not regulate calcium and phosphorus level in the body, and the treatment is vitamin D supplements to prevent the absorption of calcium and phosphorus, and the only way is to regulate through the diet. The third stage include increase in blood pressure, where the treatment is through regulating the blood pressure with medications. Coming to fourth stage, uh, it affects growth, so the only treatment is through the growth hormones. So dialysis is one of the treatment of CKD, where uh, it is one of the option for children who are experiencing kidney failure, and when they can also go for kidney transplantation. But usually this when a child kidneys are not functioning well enough to filter the blood and remove waste from the body, dialysis can help with this process. They are basically of two types, that is hemodialysis and peritoneal dialysis. In hemodialysis, a machine filters the blood to remove the waste, and then clean blood is returned back to the body. Whereas in the peritoneal dialysis, a small tube, usually known as catheter, is connected to the abdomen cavity, and the fluid is flushed through the catheter to remove the waste products.
Stage 5 is defined as end-stage renal disease, at which point your child needs to go on dialysis or have a kidney treatment. Both are effective treatments, and our goal is to transplant virtually all of our patients with ESRD. Around 75% of children with ESRD go on dialysis before receiving a transplant. The good news is that a kidney transplant is very rarely an emergency and never absolutely necessary because dialysis is such an effective treatment. So, how and why is growth compromised in children with chronic renal failure? According to National Institute of Diabetes and Digestive and Kidney Disease, many factors cause growth failure in children with chronic kidney disease. In addition to removing waste and extra fluids from the blood, the kidney perform important functions for a child's growth. It causes mineral and bones disorder which occurs when vitamin D is not turned into cholesterol, which starve the bones of calcium, decreases the production of erythropoietin and causes anemia, a condition that develops when the blood does not have enough healthy red blood cells to carry oxygen, which can cause growth to slow or stop. The condition also prevents the body from correctly using growth hormone, and waste get built up in the blood and body does not process growth hormone. Decreasing appetite. A children with chronic kidney disease may not be hungry, or he or she may not have the energy to eat, which can lead to poor nutrition and slower growth. There are some strategies to cope with diet restrictions. These are to replace salt with spices, herbs, and sodium-free seasoning. Eat the right amount and the right type of protein. Choose foods that are healthy for the heart, fat-free milk or yogurt. Consume foods lower in phosphorus such as fresh fruits and vegetables. Choose foods that have just the right amount of potassium. Thank you.